Hello, everyone. Thank you for inviting me to speak here today. I am honored to bring the Indigenous Dental Association of Canada to this event. The Indigenous Dental Association of Canada is a new form or a new group that I developed early in its infancy. Last year, I started putting it together. Unfortunately, it's been a long time coming, just putting together the logistics, but we launched, I guess it would be officially for the beginning of April. And so we are super excited to jump in with both feet on the floor and running. And so we were more than honored when NIDA had reached out to us to become involved in this event today. And so while this is not my area of expertise, I am more than happy to bring some knowledge, as I was a private practitioner contracted with the federal government in First Nations communities for over a decade before specializing. And so now I am a pediatric dentist out here in Saskatoon. So very quickly, I just want to introduce myself. I'm Dr. Sheri McKinstry. I'm with the Indigenous Dental Association of Canada. I'm a pediatric dentist and a proud mom of 4 grown children. I'm also a proud member of Saugeen First Nation, located on Treaty 1 territory. And I join you here today from Treaty 6 territory and homeland of the Métis. And so today I'm just going to bring to you an introduction of diabetes and oral health. While I realize that is National Aboriginal Diabetes Day, there is plenty of discourse that comes with Indigenous oral health that includes the social aspect. And so while we tend to focus on the social aspect, I think one of the things that I'm beginning to realize is that I need to come back just a little bit and just start with introductions and start from the beginning so that we're all on, I guess it would be a journey together. And so in order for us to be all on a journey together, we kind of all have to have the same understanding. And so that's what brings me here today. Is I'm here to share with you diabetes and oral health. So while this is not this presentation is not Indigenous specific, I will mention some Indigenous aspect, I guess it would be worldview in the presentation. With respect to diabetes, it tends to have it tends to behave in such a way that in order to understand how, I guess it would be the relationship between diabetes and oral health, an introduction to it, it's kind of, I guess you would think of it almost as generic. And so that's kind of where we're coming from today, is just to give you an idea and tying in diabetes and oral health in the first place. And then through the Indigenous Dental Association of Canada, in collaboration with NIDA, I'm hoping that we're invited to speak at more events where we can talk about the more social aspects and the actual delivery of oral health and things along that line. So today is more of an introduction. And so let's get going. So as I had mentioned, the Indigenous Dental Association of Canada, or IDAC as I'll refer to it, was approached by NIDA, which is the National Indigenous Diabetes Association, to participate in this event. Unfortunately, I'm not able to present live. I'm actually have been in the operating room for the last couple of days, and I will be again today, which is, I'm recording this early Friday because I just haven't had the opportunity to record it previously. And so, as you can see, it's dark outside. I'm getting ready to go for my OR day. So I'm going to record this now in case, so I don't run into any kind of issues in the OR, to try record this before the patients show up. And so I am more than happy to present. And if anybody has any questions or would like to reach out, you can contact me through, it would be IDAC's website, which would be www.idac.agency. So it's www.idac.agency, AGENCY. And so I look forward to hearing from anybody. So to begin with for this presentation, I want to first talk about our definition of oral health. And so what I went through, I've gone through a couple of the regulatory board websites looking for, it would be not only the definition of oral health, there's a plethora of information available on through resources, and it would be scientific resources for me to use. However, I was looking for something that was more aimed toward, I guess it would be the general population in addition to providers. And so with that being said, I went looking for, I guess it would be resources in regulatory bodies and those governing the divisions of oral health, which would include the Canadian Dental Association. However, I guess the Canadian Dental Association, in addition, they also actually have come back to the FDI's the World Dental Federation resources that they use on their site. So it seemed like a pretty significant resource to come to. And so here, I'm just going to give the FDI's definition of oral health. So oral health is multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain, discomfort, and disease of the craniofacial complex. Oral health is a fundamental component of health and physical and mental well-being. It exists along a continuum influenced by the values and attitudes of individuals and communities. It reflects the physiological, social, and psychological attributes that are essential to the quality of life. And it is also influenced by the individual's changing experiences, perceptions, expectations, and ability to adapt to circumstances. And here, it was just a very, it's actually a very detailed look, more of a diagram at basically what we had talked about. And so I guess the major thing to take out of, the major thought to take out of this, and what I had said previously, is that we can't think of oral health in isolation. So oral health can't be thought of on its own. Oral health is a part of the person, and the person is part of our environment. And therefore, because we are functioning within that environment, we have a lot of determinants of health and a lot of external factors that are determining our health. And when it includes, or in when it actually impacts our overall health, it also impacts our oral health. And so this information is also from FDI World Dental. And so here we start to begin to tie in. So now that we thought about a person that's functioning in society, a person that is actually living and being, and now we consider the oral health, and how does that tie into, impacting other parts of our body, or impacting how we live, or impacting on how oral health impacts us. And so keeping the mouth healthy is crucial for maintaining general health and well-being. If not properly managed, oral disease can negatively impact the rest of your body and affect every aspect of life, including personal relationships, self-confidence, as well as school and work attendance and overall performance. The healthy mouth may also help in prevention of other health conditions such as heart and respiratory diseases, cancer, and diabetes. Oral health is about much more than healthy teeth and good-looking smile. The mouth is a mirror of the body, often reflecting signs of other diseases. For example, oral lesions may be the first signs of HIV infection, and changes in tooth appearance can indicate serious eating disorders. And so as a dental practitioner, we are taught to be watching for signs and symptoms that we may actually be the ones to actually start to notice changes in the mouth and finding things and telltale signs that might lead us to certain diagnoses or referrals to physicians for those diagnoses. And so in another aspect of how oral health impacts us today is that Canadian dentists function, I guess it would be a little bit outside of the healthcare system, in a sense that we are not part of the healthcare system, whereas the healthcare system, if you go to the hospital, your medical is basically covered through a program, a Canadian program, whereas oral health isn't covered for everyone. And so, when speaking in an Indigenous context, we have groups in Canada. We have First Nation status, we have non-status First Nations, and we have Métis, and we have Inuit. And so with respect to those groups, not all groups have access to the NIHP program that covers the dental, the financial part of the dental care. And so it's very important to recognize that diabetes can also be different for Indigenous groups in Canada as well. But here, now the important part again is here we're talking about how we're starting to talk about how oral health actually impacts our body, but then we're also talking about how our oral health can impact even the mental part. And so when we're bringing this definition into consideration, it's starting to look a little bit more and sound a little bit more like Indigenous worldview. And this is a worldview that I became very familiar with as I grew into adulthood from my own lived experience. And then so kind of tying it in just a little bit more to get a little bit of a closer view, we have, this was actually borrowed from the First Nations Information Governance Center. And here I come back to this quite often. And the reason I come back quite often to this one is because number one, it's very difficult to find literature on oral health where it's tying it into, I guess it would be oral health and in an Indigenous perspective with respect to, I guess it would be the researchers that are First Nations doing research for First Nations. And so with respect to the First Nations Information Governance Center, it's kind of my go-to information. And so with the regional health survey that they have, there are 3 reports that are available. And there is a 4th one in the works at this time. So I'm looking forward to updated information and the inclusion of oral health in that report. And yeah, and so this is something that I come to quite frequently. It's what I consider one of my Bibles. If there's something, especially where I want to start my research or start my gaining knowledge, having resources, I do come back to the regional health surveys. And it also shows me the trends from the 1st, 2nd, and 3rd. And so in this report, we have, so this one is phase 3, volume 1. And so in here, we actually have oral health included in there. And so for me, this is actually very important. So oral health is integral to overall health and well-being throughout the 4 phases of the life that are recognized in First Nations culture: child, youth, adult, and elder. And so from breastfeeding of infants, the arrival of the first baby teeth, and the completion of the permanent dentition in adolescence, healthy teeth help in the nourishment of young bodies and the promotion of self-esteem. Later in life, healthy teeth and gums allow adults and elders better enjoy life and maintain their body, mind, and spirit. And so for me, that part is all encompassing and very important. And the way I look at and practice, I guess it would be my own personal life, but also as a provider myself. And so this is one of the perspectives that I always bring to the table. I also have a master's of public health from the University of Victoria, specifically in Indigenous people's health. And coming into that understanding, it is imperative that we understand Indigenous history of Canada and the colonization process, because this is all contributing to how all the obstacles that we're dealing with today. But it also, over all this time, it's very important for me to remember not to come from a deficit approach and to understand the resilience of First Nations and Indigenous people in Canada. And so with respect to this definition that we're given here, we have the mention of the breastfeeding of infants. Like the beginning was the breastfeeding of infants. One of the, I guess it would be in sociology, and also more so my master's of public health training I have specifically with Dr. Charlotte Lopi is that even when we're considering the life course, or so is, we've talked about the life course here, and it's starting, with the child, youth, adult, and elder. One of the things that we do really consider and take into consideration when we're talking about the life course is that the baby teeth, the thought of the baby teeth happened even before the conception of the baby, while the baby was even in utero, while baby is still in mom. So even before that, we have to start considering and thinking about the overall health of the baby, because the baby is going to grow up in the mom, which means the mom has to be healthy. So, we have to go back even just a little bit farther than starting from breastfeeding of infants. And within this definition, it's very important for us to remember, with the training that I received, going back to the distilled determinants of health that actually have impacted Indigenous health and overall health, including oral health today. And so the distilled determinants of health are, for example, with colonization, the residential school system. But one part that doesn't get spoken about so frequently when we're talking about Indigenous oral health is the self-determination. And so this is even changing today, because we're not starting to see the terms self-determination, for example, in Jordan's principle, and how the consideration has changed so much from, I guess it would be discriminating practices. It was found in courts. It's not something that I'm making up, but it's a different way of looking. And so when we're thinking about diabetes, in another discussion, when we go into looking at, I guess it would be the social components or the determinants of health impacting diabetes, we have to understand that a lot of external factors come into play when we're considering diabetes and oral health. So a little bit off topic there, but that's kind of where research is, and where we're kind of going in that area. Another area we're going as well is accessing care, but it's culturally safe care. And so we have this evolution, and following the Truth and Reconciliation report, and of course the calls to action, we're changing our mindset and on how Indigenous people have always been delivered care from the status quo. And so we're trying to change, because the status quo doesn't necessarily work for us. And again, that was off topic. So let's get back on topic here. So another resource I found very helpful going to is the Centers for Disease Control and Prevention, or otherwise known as the CDC. And so here I took their quote, I quoted directly from them, because I thought it was very important the way they had worded it. And so a healthy mouth is important for everyone, but high blood sugar can make it harder to keep your mouth healthy. If you have diabetes, learn how you can avoid oral health problems and keep a smile on your face. Taking good care of your mouth is essential to general health and well-being. It even affects your self-esteem. Good oral health habits can help prevent pain and infections from tooth and gum disease. And if you have diabetes, taking care of your teeth is even more important. High blood sugar can weaken white blood cells. These are your body's main way to fight infections that can occur in your mouth. And keep that smile on your face, though. By managing your diabetes, you manage more than your blood sugar. You're helping to prevent gum disease and other infections in your mouth. And then, so as I go on with our presentation, so just keep this in mind. So we're talking about weakening the white blood cells. And the white blood cells is very important to understand that this is the way that our body, the way we fight infections. And so if there's any compromise of our white blood cells, then we have compromise of fighting infections. And then at the very bottom, it says you're helping to prevent gum disease and other infections in your mouth. And so with respect to that, we'll also talk about a two-way relationship between oral health and diabetes as well. And then so CDC went on, if the sugar level is high in your blood, it's high in your saliva too. Bacteria and plaque, a sticky film, use sugar as food. And some of these bacteria can cause tooth decay, cavities, and gum disease. If the tooth is not treated, it can also lead to tooth loss. Gum disease can be more severe and take longer to heal if you have diabetes. And if you have gum disease, your diabetes may be harder to manage. And so later on as we go on with our presentation, we'll touch base on this just a little bit more too. So here's a quick look at how diabetes can take its toll on your oral health. So you may have less saliva, causing your mouth to feel dry. So dry mouth is also caused by certain medicines. And so some of those medicines could be taken by those with diabetes, for diabetes, or in conjunction with. And so your gums may become inflamed and bleed often. And so this is signs of gum disease. Now, caution with that statement, however, is because if we do find that our patients are smokers, there's less tendencies to bleed and become visibly, to become a visible diagnosis for periodontal disease or periodontitis. And so with that being said, it makes it a little bit, it kind of masks the effect of us being able to see how severe the disease process is in the mouth. So just caution with that one. And so infections in your mouth can also take longer to heal. So we're talking about the delayed healing because of diabetes. It comes with diabetes. And then very quickly to come back to that one as well. So with the delayed healing, a lot of that is, you have to keep in mind that that is associated with poor control of diabetes or uncontrolled diabetes in a sense, is where we tend to find the delayed healing. And then coming back now, so we've spoken a little bit more about the generalized statements that the organizations out there. And so those were the two best resources for giving you an example of their perspective and their take on oral health and diabetes. And so now we're going to come back to the FDI, World Dental Federation. And so this is kind of our where the Canadian Dental Association goes to, which means that the provincial dental regulatory bodies are referred to as well. And so as a assistant professor at the University of Saskatchewan, one of the things that I had done, one of the first courses I started teaching was in a first year course, and this was also a main resource that I came back to for the first year dental students as well, because like I said, if we're going to start on a journey together, we kind of all have to start at the same position. And this is an understanding that I come to with my experience at the Indigenous Dental Association of Canada. As we start, we are inviting everybody to come and join us in our reconciliation journey, because IDAC is built on the spirit of reconciliation. And so now we're getting into this two-way relationship between periodontal disease and diabetes. So people with diabetes are at an increased risk of developing periodontal disease, and treatment of periodontal disease often improves blood glucose levels. And so here we're starting to change our gears. So now we're not just talking about diabetes causing periodontal disease, but we're talking about the mouth and how this two-way street. So basically it's saying at this point is that our periodontal disease and having an infection or inflammation in the mouth can actually impact our diabetes too. So it's coming back to a two-way street, a two-way relationship. And so hyperglycemia can result in more sugar in saliva. And then this sugar contributes to tooth decay and periodontal disease. And so with respect to this one, we'll be a little bit more careful, as we'll see later on again in the presentation, is that some studies have found that there is an increase in sugar in saliva with those with hyperglycemia or higher glucose in the blood. However, some have not been able to make that association. So this one is a little more generalized statement. And then hyperglycemia can harm the blood vessels in the gums, making them more likely to get infected. And we'll go on and describe those just a little bit more in detail, but not too much detail. I'm only given a certain amount of time here to present. And so the biggest resource that I'm using today is from this. So this one actually comes from the Diabetes Research and Clinical Practice. And so it is was printed in 2019. So it was in the journal in 2019. And so this is actually the IDF Diabetes Atlas. And so it actually did basically a big review of a bunch of all the current scientific evidence. And it was looking for the bidirectional associations between oral health and diabetes, and then summarized it for us. And so I thought this was the greatest literature for me to use for today's presentation, because it takes us right back to almost generalized understanding. And maybe listening to this, somebody in the audience might say, you know, I didn't know that. And so here we were told it's a vicious cycle. Unfortunately, I couldn't find a diagram to make a vicious cycle. So it's kind of a back and forth, but let's pretend it's a vicious cycle. So we have dysglycemia, which adversely affects oral health, and it manifests in oral diseases and conditions in oral health. with oral health, we have infection with local and systemic inflammatory responses adversely affects blood glucose levels. In that aspect, the dysglycemia in the oral health, what we can have in the mouth is painful, loose, or missing teeth. And so that can impact the quality of food or the type of food that we eat, and it most likely be a softer food, which isn't necessarily nutritious food. And so therefore it can negatively impact nutrition and contribute to poor glucose control in existing diabetes. And so now we're starting to see this bidirectional impact that diabetes can have on oral health, and what oral health can have on diabetes. So in this article, it's summarized with these main topics. So diabetes mellitus hyperglycemia adversely impacts oral health. And so we see periodontal diseases, caries, early tooth eruption in children, dry mouth, tooth loss, candidiasis, delayed wound healing, iron precipitation in dental tissue, oral cancer, and then of course there's dental diabetes complications. So with a diabetic neuropathy, diabetic retinopathy, diabetic nephropathy. And so I'll talk a little bit more about the neuropathy because it's a direct impact, and the other two are associations. But with the neuropathy, we'll go into that in a little bit more detail. And so with respect to periodontal diseases, we have dysglycemia adversely affects periodontal health in a dose-dependent response manner. That is, the greater the glycated hemoglobin level, the greater prevalence and progression of periodontitis. And so the prevalence, and so here I was able to pull out some of the, I guess it would be there's also some numbers and statistics in here. So prevalence of moderate severe periodontitis is about double for those with diabetes compared to those without. And it is also triple for the 30 to 44 year age group with poorly controlled diabetes compared to those without diabetes. And any effect of diabetes on periodontal issues is determined by its level of dysglycemia or glycemic control. And diabetes is shown to be the most important systemic disease that negatively impacts periodontal tissues. And so this is considered a sufficiently strong risk predictor for periodontitis. And so a new classification that the Periodontal Association has come out with actually includes this diabetes as one of the most important systemic diseases. With respect to caries, so some studies have found that diabetes are elevated glucose in saliva to be associated with more caries. I'd mentioned this earlier. And while those with diabetes do not necessarily have more cavities, they do experience a greater risk of periapical lesions and larger lesions, and also take longer to heal. So that part is very important to remember. So when we're talking about periapical lesions, typically those are infections that are happening at the tip of the root of a permanent tooth. And so people with diabetes have much more periapical lesions. So that's from both untreated pulp necrosis. So when you have a large cavity and the bacteria gets into the tooth and it gets an infection, and endodontic treatment, which is very interesting. And so this is root canal treated teeth. And this is possibly due to diminished immune response. And I apologize for the spelling error. And then in one study, and I ran out of space to put my resources, but the resource is actually available in the article that I have provided you, the screenshot of the article. And I do advise everybody to read it because there's more associated with that article, and it goes into talking about treatment as well. And so one study found those with poorly controlled diabetes double the prevalence of periapical lesions compared to those with well-controlled diabetes. So that's infections. And another study found that endodontically treated teeth in those with diabetes had 2 times the risk of being removed compared to those without diabetes. And so those are the root canal treated teeth, so they tend to be removed more often. And so here, kind of just a little bit quicker. So we had mentioned early tooth eruption. So children 12 to 14 with diabetes, especially girls, they tend to get their permanent teeth erupting a little bit sooner than those without diabetes. And so the problem with this is that it actually results in malocclusion, impaired oral hygiene, periodontal disease, and caries. And so with respect to caries, It could be because of the malocclusion. It could be crowding, ectopic eruptions and things along that line, but also because the teeth have been come in a little bit earlier, so they're in the mouth a little bit longer. And then in the addition to that is the younger age, as permanent teeth are erupting, they're very susceptible to caries as they're coming through, because those ones are also very hard to clean because of eruption. We also can have dry mouth. So this is hyposalivation, or a decreased output from neuropathy and medications, and can result in an increased glucose, decreased antimicrobial substance that results in oral diseases, and that's taste disturbance, halitosis, coated tongue, fissured tongue, periodontal diseases, periimplantitis, periodontal diseases, caries, delayed wound healing, predisposal to oral mucosal lesions such as candidiasis and lichen planus. And then, of course, if we have hyposalivation, so if we have not enough saliva in our mouth, then we lose retention from our dentures. And of course, then if our dentures are loose, then we can have difficulty speaking, chewing, swallowing, because we don't have the suction to hold the dentures in place. In addition, even if we are dentate or we have our teeth and our mouth is dry, it becomes difficult to speak and chew and swallow as well. We can also have tooth loss. And so we had mentioned that about 2 times, about double of those with diabetes have reported to losing teeth compared to those without diabetes. We can also find candidiasis, which is thrush, delayed wound healing, we had mentioned, and diabetic neuropathy. And so here I said I would mention the diabetic neuropathy. So we could have burning mouth syndrome, taste impairment, hyposalivation, and xerostomia. And so on the other end, on the way back, so oral health adversely affects diabetes, mellitus, and hyperglycemia. So with respect to periodontitis, so people with manifest type 2 diabetes, prediabetes, or known diabetes who have poorer periodontal health, have poor glycemic control than those with better periodontal health, which is showing that those with periodontal health, it actually impacts the glucose levels and the abilities to manage glucose levels. And longitudinal studies show that people without baseline diabetes who have poorer periodontal health have greater risk of developing type 2 diabetes than those with better periodontal health. And one study at Taiwan data from an insurance company actually showed that those with periodontal disease requiring periodontal surgery had almost 30% greater risk of developing type 2 diabetes within 2 years compared to those with less severe periodontitis. And then those with periodontitis and type 2 diabetes show increased inflammatory markers for in periodontal pockets. And so with respect to periodontitis, so basically it's the destruction of the bone, the gums, and the complex that's supporting the tooth structure. And so that basically just keeps going away as there's destruction. And with the periodontal pockets, basically the tooth sits inside almost like a hammock or a sling. And so that part is even impacted in this as well. And so we have caries, and this is due to problems chewing due to pain sensitivity, results in poorer nutrition and hence poorer glycemic control. And then tooth loss, so it can result from untreated periodontitis and caries. This results from preferentially eating a softer diet consisting of fat, sugar, and salt. And the association was recognized, association between the two, but it's a questionable direction of association. However, they found it's likely a two-way relationship between oral health and diabetes. And then prolonged hyperglycemia has shown to result in glycated substances on the root's outer surface. And so this is called the cementum. So it's just the outer layer of the root. And so this can lead to the impairment of the attachment of the fibers that hold the tooth in the socket, which can lead to tooth loss. As I had mentioned, a little sling basically holds our teeth in place and keeps it healthy. And then that is kind of impacted with this process. And so conclusion from the summary of the report is diabetes and oral health can adversely impact each other. Regular follow-up and treatment for sources of oral inflammation can significantly decrease blood glucose levels. So going to see your dentist frequently, having your cleanings done, which is the non-surgical periodontal care. So it's basically a good cleaning in there. So non-surgical periodontal treatment and extraction of infected teeth leads to decreased blood levels of glycated hemoglobin and inflammatory markers. And then so the mobile, painful, or missing teeth results in poor nutrition and diminished oral health related quality of life, which unfortunately some of us get to experience. And then replacement of missing teeth can improve eating, self-esteem, and quality of life. And the common theme in all of these statements is that regular visits to your oral health provider is imperative. Even if you don't have diabetes, because if you're in early pre-diabetes, we might be able to see those differences and catch things sooner. So what does diabetes have to do with oral health? And so the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And so this is kind of an Indigenous worldview that I keep coming back to, is that we're thinking about health. Let's not think about disease. Let's think about what we can do to make ourselves healthy. And so to make ourselves healthy, we have to work with our oral health provider, and oral health providers have to work with a team as well, because as we know, diabetes impacts the whole body, right? And so teeth cannot just be considered teeth. Teeth are located in a body, in our body, and the body is located in its environment, influenced by all the other factors, and teeth impact health, and health impacts teeth. Health is cumulative over a life course, over one's life. And again, I mentioned we have to start thinking about even before that baby is conceived. And so that's all I have for today. Again, if you have any questions or concerns or would like to reach out to me, you can reach me through www.idac.agency.